Hello everyone, I'm Dr. Patil, consultant neurologist at SurajHospital. Today we are going to talk about a rare but a very serious disorder called Guillain-Barré Syndrome. Guillain-Barré Syndrome is an autoimmune disorder, meaning body's own immunity acts against body's own tissues. Generally, immune system attacks antigens that affect body from outside. But in autoimmune disorders, body's immunity attacks its own cells, and in this condition, the nerve cells. Attack on the nerve cells results in variety of symptoms like difficulty in walking, standing, turning in bed, difficulty in using hands, and even in later stages, difficulty in breathing. Guillain-Barré syndrome, if not detected early and treated promptly, can be fatal. Around 80% of the cases are mild and could be managed with medicines, while 20% cases they may be fatal despite medications, and they are called difficult to treat GBS. So whenever a person suffers from certain fever or respiratory infection or diarrhea, loose motions, following a respiratory infection or diarrhea, if there is weakness in the form of difficulty in walking and using hands, you should immediately contact a doctor. They will do a study called nerve conduction study, on which we come to know about the diagnosis, and maybe some other tests like cerebrospinal fluid test and some blood test and MRI will be ordered in order to confirm the diagnosis. The treatment initially is supportive in the form of oxygen if required, or ventilator if there is even more respiratory difficulty. The main definitive treatment is in the form of IV immunoglobulin. These are artificial antibodies which are prepared from human blood, and these are injected so that they compete with the abnormal antibodies and prevent the nerve cells from getting damaged. The other line of treatment is called plasmapheresis or plasma exchange, in which the patient's plasma, which is having abnormal antibodies, is dialyzed with the help of dialyzing machine, and it is exchanged with the fresh another plasma, which again prevents the nerve cells from getting damaged. If not treated early, GBS could be fatal, but if treated promptly, there can be complete recovery. So if any of the symptoms are noticed, contact your nearest neurologist immediately. Thank you.